Okay, so welcome back to our monthly webinar series. I'm Simone DeCarmo, so I'm the course coordinator at the Center for Integrative Sports Nutrition. Now, today's our second webinar of the series. We hosted our first one last month, which is available on the website, the recording. And today we have Mark, who'll be talking about integrating sport and exercise nutrition principles for tendinopathy recovery. But before I pass it on to Mark, I just wanted to give a little highlight of our level 7 diploma, because all of our webinars actually this year are being presented by our level 7 diploma students. So all the research that they do, the preparation that goes into the webinar, and the actual delivery of the presentation counts towards their hours of study. Now, our level 7 diploma is our flagship sports nutrition program within our course portfolio, and it is delivered fully online. So there are recorded lectures and resources for students to go through in their own time. And then we have the weekly tutorials, workshops, so students can have that interaction with lecturers, tutors, and their peers. It is equivalent in education standard to a postgraduate diploma. So you're looking at 120 level 7 credits. And now our next aim is to link up with the university so that students can upgrade to a master's if they wish. Now, just to give you a little bit of an overview of the level 7 diploma, it consists of two long base 8-week modules. So the first one is all about the integrative model and how it applies in a sporting context. The second module is applied performance nutrition. And then students go on to doing 4 specialty modules. So they have a choice. And just some examples include gastrointestinal health in athletes, hypertrophy for sport and exercise, RED, so relative energy deficiency in sport, harnessing mitochondrial energy, ergogenic aids. So we're actually starting that one tomorrow, which can also be done as a standalone CPD. So if anyone is looking for some last minute CPD, you're more than welcome to join us. And then we also have a natural sports cookery course. So this one's slightly different, slightly longer as well. So 5 weeks, and it's all about food. So it's learning about amplifying the nutritional density of food, how to make foods more digestible and assimilable by the body, and how to basically elevate an athlete's eating routine. Students then go on to doing a practical mentoring and case studies module. So after their specialty modules. And for this one, it's all about developing their practitioner skills. And then to complete the diploma, they then design and implement a research project. Now, a level 7 diploma is open to individuals with a university degree or relevant level 6 qualification, but we do accept applications from individuals that have a relevant professional qualification plus some industry experience. So you're looking at personal trainers as an example, health coaches, etc. Now, our next cohort does start on the 27th of May, so that's next month. So applications are open. What I will do is I'll post a link to the webpage, the diploma webpage, in the chat box if you'd like to find out a bit more. But please also feel free to contact us if you have any specific questions about our diploma or any other of our course offerings. And if you are interested, feel free to also fill in one of the expression forms on our website. Even if it's not for this cohort, it can be a future one as well. Okay, so enough from me. I'm going to pass it on to Mark. I'm really looking forward to listening to this presentation. Mark is a brilliant chiropractor who does bring in a lot of the integrative thinking into his practice. Okay, so now to you, Mark.
Thank you so much. So, good evening, everyone. I am obviously a chiropractor here in the UK. I originally qualified in 2019 from the University of Johannesburg in South Africa. And in 2020, I decided to leave the sanity and sunshine behind and come to unpredictable weather in the UK. I obviously uprooted up in Leeds. That's where I currently practice. And I've got a clinic up in Wetherby. I then decided, after about a year's worth of practice, and obviously been quite busy in my clinical practice. I've seen a lot of individuals with sports types injuries and quite complex cases. And I thought I need to learn a little bit more about how I can help and manage these patients. And so I decided to study sports and exercise medicine in 2021. Obviously qualified with the postgraduate diploma in sports and exercise medicine in 2022. And then one of the modules in that course was on sports nutrition, and I absolutely fell in love with it. And I just wanted to know a little bit more about obviously sports nutrition. And so I found the Center for Integrative Sports Nutrition with Ian and Simone, and I haven't looked back. I completed a certificate in the Integrative Sports and Exercise Nutrition in 2024. And I'm currently now on the diploma course. I did open up my own clinic during this time in Wetherby, as known as the Nexus Health Hub. It's a multidisciplinary clinic where I am collaborating with a functional medicine doctor with her functional medicine care team in providing quite advanced sort of pain management care for individuals. So we do a whole lot of different health, vitality health checks. We do point of care vitamin D testing. We do blood work, phlebotomy, and then obviously Dr. Indra, who is the functional medicine doctor, she takes care of all the patients' health and well-being, while I obviously focus on my job and my role in obviously the treatments that I provide. And on the pictures on the side here, you can see I provide shockwave therapy and as well as MRS laser therapy in my clinical practice, two very unique treatment modalities with very specific therapeutic effects and very effective effects they are. And obviously, today we're going to be talking about the role of integrating sports and exercise nutrition principles in the treatment of tendinopathy. So we need to obviously get a little bit of context around this and understand obviously the prevalence of tendinopathy and understand that this is a very complex condition to treat. And there's two key things from this research article by Lucas Lopez. And the first one is we got to understand that it's 2 times higher prevalent in athletes with extremely high training exposure than compared to individuals with low exposure. So here we already have a load issue, all right? We know that if patients are coming through with tendinopathy, we know that they're potentially overloading that tissue. The second thing around this, and which makes it quite complex for me to treat tendinopathy, is understanding that anti-inflammatory drugs actually are linked to a loss of training in athletes and a reoccurring episodes during their sports career. So the crucial thing here is, how do we manage patients who are taking anti-inflammatory drugs when they come and see you? Because most of them do. If they're experiencing pain and their tendon is slightly thickened or there's a bit of edema or swelling around that area, the first sort of treatment or line of treatment that they go to is anti-inflammatory. So what do we do with these individuals? And usually we'll get them off of the anti-inflammatory drugs. Now, the thing about anti-inflammatory drugs in the treatment of tendinopathy is that tendinopathy is not just an inflammatory condition. It's a collagen disruption condition where there's cell death and disorganization in the tissues. And therefore, anti-inflammatory treatments may not address the pathology. And there is evidence that they might actually impair tendon healing. So we want to try and get individuals off of the anti-inflammatory drugs as soon as possible when they come through the door and educate them on that. Obviously, in tendinopathy, individuals are going to be experiencing significant financial loss. They're going to have interruption to their sports careers. And we need to be the pivoting practitioners who change the direction for them and give them the best possible care. Now, part of that is nutrition and offering nutritional advice, recommendations. Now, we know that there's tendon injuries obviously cause a great deal of disability and pain and increased medical costs for these individuals, but it's understanding the actual pathophysiology around that tendinopathy. And there's a lot of concepts out there at the moment, and there's no firm evidence around what's actually causing the pathophysiology effect leading to tendinopathy. But preliminary evidence does suggest that there's various nutrients, such as proteins. So obviously in this sentence over here, amino acids, vitamin C, vitamin D, manganese, copper, zinc, and phytochemicals, which may be used for improving tendon growth and healing. And so we know that nutritional therapy could be a really effective treatment modality or treatment for these individuals coming in with this condition. Obviously, we need to kind of dive a little bit more into detail about the condition. So what is it specifically that we need to understand? The basics of tendinopathy is that it's a broad clinical term used to describe chronic tendon pain and dysfunction associated with degenerative changes of the tendon. We've just explained that there's characterizing swelling and impaired function in the affected tendon, and tendinopathy typically results from overuse, aging, and injury. The anatomy of the tendon, we need to understand the function. Obviously, it allows tendons to connect muscles to bones and allows the transmission of forces generated by the muscles to bones, resulting in joint movement. So the movement of the musculoskeletal system. We need to go a little bit deeper and understand what the structure is like, the microarchitecture of that tissue. And so we look at what is it made up, and there's two main things. It's got a cellular makeup and it's got an extracellular matrix makeup. And this is important to understand because when we understand what's going on within the tissue at a cellular level and at a microstructural level, we'll be able to bring in the rationale for certain treatments and understand the sort of effects that we are eliciting or trying to stimulate in the treatments that we provide to these patients. So obviously, we need to know that tendons are not just passive cables. They contain specialized cells like tenocytes. Obviously, 90% of the cell makeup is of tenocytes. It's also got stem cells, immune cells, and these are actively responding to load and injury and inflammation. All right, so is inflammation the actual cause of a tendinopathy? Potentially, but that might be starting at an immune level. So we need to obviously assess the individual's immune system or provide support around that. Other areas we'll be looking at gut health. But back to obviously the makeup of this is that these cells all work together to maintain the extracellular matrix. They repair damaged tissue and they adapt to the mechanical stress. When we look at the extracellular matrix, this is the scaffold of the structure. It's the framework. And obviously, this is the defining, it basically defines the tissue shape and structure. And as a substrate for cell adhesion, growth, and differentiation. It's got mainly two aspects of it. You've got a collagen makeup and then a non-collagen makeup. And the collagen makeup is mainly of type 1 fibers, type 1 collagen fibers. And in tendinopathy cases, you have a conversion or a effect where the type 1 converts to type 3 collagen fiber, but we'll describe that a little bit more in detail later. Here, we're also looking at what the non-collagen makeup is, and we've got proteoglycans, glycoproteins, and glycoconjugates. Now, obviously, the anatomy and the physiology is quite complex, so I'm going to bring in a little bit of a simpler explanation to describe what's actually going on within a tendon. And here we understand that, for good tendon health, we need really tendon ring. I described to my patient. Sorry, can everyone hear me there? Yeah, perfect.
Sorry, Mark. Yeah, your signal sometimes
it drops out there. Yeah. Sorry, I saw that now. Obviously, tendon remodeling. Now, when we are born to the ages of 20, our bodies are going through a process of modeling. It's developing into the adults we are now. And then once we hit that sort of age of adulthood, we then move into a remodeling effect within the bodies. Our body's constantly breaking down, building up, breaking down, building up, breaking down, building up. And it depends on the load that you're placing on the body, the stress, and that's going to have a major effect on that remodeling process. Now, what happens when we have adaptive tendon remodeling? Now, this is really good remodeling. You've got a happy household over there. Hear me out, because I just wrote this down here for me to explain correctly so I don't miss any specific aspects of it. But I've related this to basically a house renovation, all right? Imagine your tendon is your house. It's standing strong. Obviously, over time, normal wear and tear from life, aka exercise, sport, daily activities, start to show. Obviously, you get creaky floorboards, the stairs become wobbly, the kitchen cupboards come loose, the sink obviously needs repair work. Now enters the husband, wife, and a builder. Obviously, they're talking about a little bit about renovating this house. And to describe what's going on in this sort of scenario, the wife is the tenocytes, okay? The builder is the ECM, the extracellular matrix crew. You've got the stem cells and the immune cells all being part of that process around that area there. And then you've got the husband, who is potentially applying the mechanical load. Now, the wife, aka the tenocyte, she's the project manager, all right? She notices the issue first. She's detail-orientated. She obviously notices that the stairs start to creak when you walk, the paint's peeling, and she says, listen, we need to fix this. She sends signals and starts coordinating repair. She's in charge of ordering, obviously, new collagen and making sure that the builder is doing the work correctly. The husband, aka the one applying the mechanical load, he's the one actually using the house, all right? He's walking up and down the stairs maybe 100 times a day. He throws his gym bag on the side. He's stomping with his feet along the floorboards. Now, he doesn't really always mean to cause damage. He just lives life enthusiastically, all right? And sometimes, you know, he might make the odd decision without telling anyone that he's going to knock down a wall and make this space open plan. That's where some injury might come in place. But the builder walks in and says, okay, we need to look at how we can actually repair this system. So he's the guy that comes to fix things. If the wife tells him, and if the husband obviously gives him enough time between, you know, the jobs that he's doing, then you're going to have a really good effect. You're going to have a controlled environment. But if the husband keeps storming, obviously through the house while the builder's on the ladder, fixing the ceiling, well, obviously repairs never really get done properly, all right? So what is adaptive remodeling? And in this case, the wife, who is the tenocyte, senses that there's micro damage, all right? There's pressure, there's load, so it responds to the load. The husband, obviously, is the load, and he's just loading just enough to stimulate the process, but not too much to cause chaos, because if he applies too much load, we all know what happens if the wife becomes annoyed or irritated, all right? The builder obviously has time and resources, aka rest, nutrition, good blood flow to be able to do the job properly. What's the result? Obviously, a strong, upgraded tendon, more resilient, better lined, and obviously ready for action. But if the husband obviously never stops breaking things, disrupts the builder. The wife gets overwhelmed. The builder obviously gives up, and the house starts falling apart. And now you've got tendinopathy, the renovation that obviously never finished. And that is my brief description of the effects and pathophysiology of tendinopathy. To take this into a little bit more detail, we need to look at this research by Jay Cook, who actually describes 3 phases of tendinopathy. And we've got the first phase of reactive tendinopathy. This is where you've got acute overload beyond the tendon's capacity. The tenocytes become activated and increase their production of the extracellular matrix. They obviously attract water, and this results in localized edema. And that is where you get the swelling around the tendon initially. So you might have a little bit of sensitivity around that tendon. It doesn't mean that there's inflammation. It might just mean that there's a slight little bit more water being held in that tissue causing edema. This phase is reversible. And this is where if you've got patients coming in who are experiencing discomfort, it's been 1 to 2 weeks that they've been experiencing this pain, this is where your treatments are going to be critical, all right? Because here we can reverse it and we can prevent that disrepair phase. When it becomes chronic, this we're looking at about 3 months or greater, and if there's a lack of recovery or reductions in that load, we're going to have an abnormal proliferation of the tenocytes. So the wife is obviously going to be really, really agitated, and this is going to lead to the production of immature type 3 collagen cells, fibers, with neovascularization. The collagen fibers become disorganized, and obviously the extracellular matrix break down, and this leads to swelling and dysfunction. This is partially reversible. Phase 3, obviously you've got the degenerative tendinopathy, and this is prolonged and untreated overload. This is where you've got the reduced ability of the tendon to repair itself due to degeneration, chronic low-grade inflammation, and impaired cellular activity. This is where you have obviously fibrosis, calcification, disruption of the collagen fibers, cell death, and this becomes very largely irreversible. And this phase, you need to understand that you've got a high risk of tendon rupture. So if you've got patients coming in phase 1, phase 2, you know that the treatments that you're going to prescribe them with exercise prescription, with shockwave, with laser, you can really have a good effect in preventing it from getting to this degenerative phase, where it becomes largely irreversible. And then it becomes about symptom management, and you're going to have a long walk with your patient for the rest of their life, managing their symptoms and trying to keep them as active as possible. And this becomes very difficult in our environment. So just to take a short break from obviously everything I've been describing there, quiz time. Approximately how many tendons are there in the human body? Is it A, 206, B, 850, C, 1,200, or D, 4,000? You can type in the text box if you want, otherwise I'll wait about 5 seconds and reveal the answer. You ready for the answer? You're going to be really surprised. I'm sorry. B, which is 4,000 tendons in the human body. And I can't name them all, so don't ask me. I wouldn't be able to tell you. But there's roughly about 640, 650 different muscles in the body. Everyone is different. There's different variations, and there's obviously some accessory tendons. Each muscle has approximately 2 tendons, obviously attaching to bone and attaching to bones. But yeah, 4,000. So if you've got patients who are experiencing significant discomfort throughout their body, consider, is it a tendinopathy brewing? So yeah, just keep that in mind. So what is the current best evidence-based management of tendinopathy? And this research paper here basically highlights 4 areas. You've got physical therapy, you've got shock wave therapy, you've got corticosteroid injections with PRP, and surgical treatment. Now, obviously, they kind of recommend, let's start off with physical therapy. So we'll get you some exercises, send you to the physiotherapist, and if nothing changes, we'll kind of say, go for some shockwave, all right? And at the moment, in the current sort of clinical environment in the UK specifically, is the process of this is quite tedious because patients will go to their doctors, they'll get prescribed anti-inflammatories first, they'll go to their physiotherapist. The physio is going to send them 3 or 4 exercises at the moment, maybe 5, and say within about 4 to 6 weeks, come back, and if there's no improvements, then we will kind of move along with other assessments, maybe get you in for the shockwave, maybe go for the corticosteroid injections, or let's refer you off to an orthopedic surgeon and go for some surgical treatment. Now, I have to bring this quote up because Dr. Keith Barr, who's one of the renowned tendon specialists and researchers out there, he basically has this to say about surgery. And obviously, surgery may be indicated in some really severe cases, maybe in those degenerative cases where you've got, irreversible repair, then yes, by all means, let's get you functionally fit, let's get you some treatment that is going to help. But there's this idea that we have to go in and surgically repair any type of tendon or ligament injury because, and obviously, I don't know about all of you, but most of the patients that are coming in with tendon issues, they always have that fear in their mind about, do I have to go for surgery? And is this going to result in surgery? And I've got some patients who will be like, can you just refer me off to an orthopedic surgeon because I feel I'm probably going to need surgery on this. But Dr. Keith Barr says, if the ropes aren't connected, obviously we need to just tie them back together. And this is this whole notion around surgical repair. And this is not true. They actually turn over faster than skeletal muscle. As long as there's a connection there, you should be able to repair that structure. So here we've got to understand that if they're coming in with phase 1, phase 2, there's definitely going to be fibers still intact. It depends if there is some tearing within the tendon or if it's purely just a change in the cellular makeup and there's just repair within the tendon. So the question is, what is an effective treatment strategy or treatment protocol? And this is what I've implemented in my own clinical practice. And this is why I call myself an integrative chiropractor, because I won't just rely on one treatment. We want to bring in multiple different treatments because you increase their effectiveness and they work together. In my first few years, I mainly did the exercise and load management, and I struggled to treat patients. I struggled to get outcomes that were successful. I then moved on and brought on shockwave therapy and MRS laser therapy, and I saw some significant changes in my outcomes where patients started feeling significantly better, improved symptoms, and are doing really well to this current date. But then, and through the process of studying integrative nutrition, I started to integrate sports nutrition principles in my current clinical practice. And so I give advice and recommendations to patients when they come through about certain supplements, nutrients, and foods that they should be consuming, especially during the rehabilitation process. And so how do we integrate these sports nutrition principles? And this is something that we will discuss a little bit later. The question is, what are some of these sports nutrition principles initially? So we're going to go through mainly 7 of them. I call them the 7 sports nutrition principles for tendinopathy. Dr. Keith Bar also talks about some of these principles. There's quite a few sort of websites. There's a few research papers coming out. It's not a lot of strong research just yet, but all the research that is coming out shows a really good promise in terms of integrating these sort of principles in the management and treatment, especially for tendinopathy. So what are they? The first one is obviously protein intake. Now, when someone's coming in with an injury, especially a tendinopathy, we need to ensure that our patients have adequate protein because this supports tendon repair and it preserves the muscle mass during the tendinopathy rehab. And generally, you want to recommend a higher than usual protein intake, higher than some of the normal sports nutrition principles. And this is important because it provides an essential amino acid. And one of the main ones would be leucine. And there's a supplement that you can get called HMB, which is really good to take alongside sort of rehabilitation. But if they can increase the amount of protein that they're taking in, they're going to get a lot of this leucine within their diet, or natural diet. And I'm always one to first recommend natural whole foods for patients to consume, move away from processed foods, move away from high sugary diets, high alcohol consumption, especially during the rehabilitation process, because we need to create an environment that is going to set the body up for healing and repair. And these amino acids are shown to stimulate collagen synthesis and aid recovery. And like I said, one of the main reasons why we have to understand not just the anatomy, but the pathophysiology is we need to know what sort of effect we want to elicit on the human body, on that tissue to get the sort of repair that we need. And that is, in this case, collagen synthesis, all right? And that's going to obviously help aid the recovery. And so when you've got that sort of rationale, we know what sort of targeted therapies we can implement, especially with the laser and the shockwave treatment. Both have been shown to elicit and stimulate collagen synthesis within the tissue. The second one is carbohydrates. Obviously, they do matter. Sufficient carbohydrate intake is crucial, obviously, to fuel training and healing and tendon recovery. Carbs help maintain energy availability. They reduce muscle protein breakdown, and they support the anabolic environment for tissue repair. And that's an important concept over there, is the anabolic environment. This is where you get muscle hypertrophy. This is where you get muscle building, all right? And so if you keep a higher than normal carbohydrate intake, you're going to be able to maintain and reduce, obviously, muscle mass loss. And the way that it does this is it spares protein as a fuel and allows, obviously, for the repair and rebuild. So we're giving the body enough fuel to obviously get the energy that it needs to do the repair process or take protein where it's needed. The third one is collagen and vitamin C. And this one, Dr. Keith Barr basically researched collagen and vitamin C combo, combining a collagen, a gelatin with vitamin C before exercise can boost tendon healing. And the way that I've brought this into my clinical practice is I get patients to take collagen and vitamin C together at least 1 hour before they come for their therapy session. Why? Because it's shown to also increase collagen synthesis. And when I'm implementing and utilizing laser shockwave, we want to stimulate that collagen synthesis, but we can do this by preparing the body. We're going to put the body in a better state to elicit the effects that we want. So obviously collagen and vitamin C, the amount roughly 15 grams of gelatin with about greater than 50 milligrams of vitamin C. And this is important, obviously, regarding nutrient timing. We want to ensure that nutrients are taken in at a specific time to elicit a specific effect, similar to the way that we do or recommend nutrient timing for sports athletes. Number 4 is anti-inflammatory and antioxidant nutrition. I don't like saying the word anti-inflammatory too often to my patients because it always makes inflammation out to be the bad guy, and it's not. Inflammation is the body's natural healing process, and so I prefer to kind of describe these nutrients and food sources to be inflammatory modulators. All right, we're modulating the immune response. We're either down-regulating or we're up-regulating it. And mostly we want to down-regulate that inflammatory response because sometimes our immune system releases too much histamine. That then leads to increased interleukin-6 and all the other inflammatory molecules. So the body then obviously builds up all the sort of inflammation. This leads to that chronic inflammatory process. We want to modulate that effect. We utilize the laser in our clinical practice to be able to elicit an anti-inflammatory or a reducing inflammatory effect, and we modulate that inflammatory reaction. But the key nutrients here are your omega-3 fatty acids. Obviously, curcumin, vitamin C and E, and hyaluronic acid. They can help modulate tendon inflammation and oxidative stress. For instance, obviously, omega-3 supplements have shown to have modest improvements in pain and function in rotator cuff tendinopathies, likely by modulating that inflammatory response. Then we move on to micronutrient support. And this is one of the areas that fascinates me the most in terms of the sports nutrition that I have started to study. And here it's ensuring that key micronutrients are identified and utilized in the clinical practice because they are cofactors for certain energy cycles within the human body. And we need these key micronutrients to be able to increase the energy output within these cells of the tissue. And that's going to help with cellular function at a cellular level. And that's going to help with tissue repair, DNA synthesis. But one of the main ones here that we're looking at is vitamin D. It plays a direct role in collagen synthesis. And therefore, one of the first tests that we'll do with some of these individuals in my clinical practice is actually test vitamin D. We've got a vitamin D test, a finger prick at the practice. It takes about 15 minutes, and we know what the vitamin D status is. And we can give them point of care recommendations and advice. The act as cofactors, similar to vitamin C, zinc, copper, iron. They obviously, if there's an insufficiency of them, they're going to lead to impaired collagen formation, and that then slows the recovery. So if you've got these patients that are coming in who experience significant pain, they've tried exercise, they've tried shockwave therapy, I can tell you now they have not tried nutrition. So, if they're coming through, ensure that you direct them and give them the right sort of advice and recommendations, because just one supplement of vitamin D, boosting their vitamin D levels significantly, will have a major effect on that tendon healing and tendon repair process. So, and it's all about a timely effect. So if you can get a test like that in your clinical practice, great. Find a blood company that offers it online and try and get them tested as soon as possible. And this is where blood work is also really crucial. You want to be able to know what the nutrient status is of the patient and give them the right sort of micronutrient support. And I'll describe a little bit later what we are currently developing for this. Number 6 is hydration and electrolytes. Obviously, we all know that proper hydration is vital for tendon health and rehabilitation. Water is a critical component of tendon tissue, contributing to its elasticity, and dehydration can obviously hinder nutrient delivery and waste removal, obviously needed for healing. Electrolytes are particularly important because part of the healing process of tendinopathy is we need to load the tendon, all right? We need to increase the energy that's available within that tendon. And part of that is having good neurological control and response, good proprioception. And so part of my sort of nutrient assessment is or electrolyte balance is I actually do a bit of a balance test. There's no real research around this, but if there's a reduction in balance from side to side, we'll generally know that there's a reduction in proprioception, a reduced nerve output to that side. And I would say 100% of the time, I see this in clinical practice. Someone's coming in with a tendinopathy of the right patella. I get them to do the balance test. We've got a human movement analysis system that we utilize, and they do have a loss of balance on that side. So part of the rehab process is we want to improve balance. We give them proprioceptive exercises, but we can bring in some electrolytes to support that and obviously support the nerve function during the rehab process. Nutrient type suggested, obviously, being strategic in it can have a significant effect in the rehabilitation, ensuring that you distribute protein evenly across meals, and then obviously ensure that you've got enough protein within those. So we won't go into too much detail about that, but nutrient timing is crucial. So I'm going to just present, we've still got a little bit of time here, on Achilles tendinopathy. And this is a case presentation, one of my patients that I've recently treated. He's a recreational runner. This is his patient profile. Basically, his name is Tom. We'll give him the name Tom today. He's a 38-year-old male. His occupation is a marketing executive. He's a recreational distance runner. He's obviously training 3 to 4 times a week. He's covering over 20 to 30 kilometers a week. Quite significant volume. Load. Now, remember when we first started this lecture, we talk about load. And so when you're assessing these individuals, if you're not discussing load, then you need to be adding that into your assessment profile, because if you can identify where that root cause is and try and reduce that especially during the rehab, and then gradually, progressively increase load, you obviously can spare their patients a lot of grief. I've had lots of patients throughout the years, and especially my early years of practice, was they just kept running. You've got the recreational runners, they've got a event that they're training for. They've got to hit their targets every week, and you're giving them shockwave, you're giving them treatments, and actually you're potentially overloading that tissue even in your clinical practice. So the question here is, how do we modulate that load? How do we, discuss this with the patient? And so that's the question that you need to ask yourself when assessing the patient. The main goal here, our main concern, was that there was a gradual onset of pain in the mid portion of his right Achilles over 3 months. So this started with just a dull ache. He's a runner. He generally just kind of gets on with it and thinks this will go away. And it just gradually starts to get worse, becomes chronic. That wife within the structure of that tendon is not happy. There's a lot of tenocyte activity, and that's leading to this extracellular matrix breakdown, disrepair. So you need to have a discussion with the patient regarding the amount of load that they're placing on their bodies. The clinical assessment, there's no direct trauma. There was obviously a sudden increase in mileage. He's now preparing for his half marathon. He wears minimally supported shoes. I'm not really too bothered about what shoes patients wear. I usually tell them that they need to go get assessed elsewhere, because I don't specialize in that. If they're asking for assessment or help with that, I just help with giving them guidance on how to improve and prevent injury. Obviously, he's got a desk-based job, so he's not really moving much throughout the day. So there's a little bit of an imbalance here. And if you're not moving much throughout the day, certain tissues, especially if you're overloading them, are just going to contract. And especially with runners, we see this in calves. They're just going to have this inflexibility within them, or this tightness. Obviously, symptoms: morning stiffness in the Achilles tendon, pain after runs and during warm-ups, is tendon palpation, obviously within that 2 to 6 centimeter region proximal to the calcaneus. Now, the tests that I performed was a single leg hop test. All right, so we just want to kind of identify how much pain it is. There's no point really asking how much pain it is at rest because it doesn't give us an indication. It might be a 2 out of 10 when it's actually a 6 or 7 out of 10. So they're not going to cause any harm to the tendon unless you know that they're in that degenerative phase, that phase 3, where it's just been going on for years and years and years. Then get some imaging. All right. But we know that we just were in phase 1, phase 2. This has just started 3 months ago. Let's get you to hop so we can identify exactly how much pain you're in. We can also see that there's calf strength asymmetry. So here our test, basic test is doing heel raises until failure. We compare the left side to the right side, and obviously he had fewer single leg raises on the right side. So we kind of identifying a way to A, assess the strength of that calf, but B, it gives us a metric to monitor over time. All right, we'll see that that increases, and that will tell you if your treatment is moving in the right direction. You should see that within 2, 3, 4 weeks of treatment. We sent him for an ultrasound anyways. He had a hypoechoic area in the mid portion of the Achilles with mild tendon thickening, no tear, so confirmation. Did a vitamin D test, 26 nanomoles, insufficient vitamin D. All right. So what did we do initially? We told him, let's increase your vitamin D. All right, straight off the first session. Obviously, we need to build a program for those patients. So we want to kind of present this in a phased approach, similar to the way that we implemented in sports medicine. And that's where I first learned about phased rehabilitation. Was when I studied sports medicine and chiropractic. We just had specific treatment protocols, and we'll go on for so long, and then we kind of recommend you going for either increased exercise or, but through the sports medicine, I learned a lot about how we can actually phase it and start at the basics and then build the patient up, walking a road with them, because it's about that journey and giving the patients the best sort of advice and recommendations and tools that they can look after themselves, because sometimes they just don't know, they don't understand. So phase 1 is our load tolerance and pain modulation. Here, we're going to reduce the load and we want to modulate that pain response. All right. I always explain to patients that during the rehabilitation process, pain is going to be present. Okay, don't expect to be walking out here pain-free, because pain is a signal that there's something going on within that tissue, and it's a protective mechanism. And this is where anti-inflammatory medication could potentially harm or cause harm or prolong the healing process, because it reduces some of that inflammation or that pain, some of the pain medication that they're taking. And so then now they're overloading that tissue beyond its current capacity. So the goals is reduce pain, protect the tissue, and begin collagen stimulation. Here we have a loading strategy. We do isometrics, 5 to 10, 30-second to 45-second holds daily. Adjunct therapies, MIS lasers, the shockwave, kinesiology, taping. Our nutritional strategy is the collagen and vitamin C dose 1 hour before isometrics or the shockwave and laser sessions, high protein intake, anti-inflammatory diet, omega-3s, turmerics, berries, and we then correct his low vitamin D. Outcome: pain reduced from 5 out of 10 to 2 out of 10 within 3 weeks, stiffness improved, started light cycling. Phase 2, strength and building capacity. All right, so here we want to build the capacity of the tissue and the strength. Our goals is to rebuild the tendon strength, stimulate extracellular matrix remodeling, improve the scaffolding of that structure. The loading strategy that we use here, and Dr. Keith Barr is one of the ones that you should be looking at and researching and being familiar with his work. because he describes the heavy, slow resistance training. This is obviously weighted calf raises, and he's got certain techniques or methods that are quite effective when you prescribe these exercises to patients. Again, here I'm continuing just laser therapy one times a week, but I'm also bringing in movement re-education. So here we're working on balance, proprioception. We want to improve core strength, glute med activation. The nutrient strategy is we increase carbohydrates. Why? Because we're increasing the intensity of the exercise. So we want to obviously support the heavier training. We want him to have enough energy supply to be able to get through those sessions while not breaking down protein, where the protein can now be utilized in tissue repair. We want to obviously continue the collagen and vitamin C combo, pre-training or pre-rehab. And here we're still recommending a high protein each meal, maybe some casein before bed, and obviously emphasizing hydration and electrolytes outcome. Obviously, he had full strength recovery by week 8, pain-free walking and low speed jogging. So we've obviously now started to implement and increase some of his load within the tissues. Phase 3, here we're looking at energy storage and return to sport phase. Here we utilize plyometric exercises and obviously get him back into some of his normal sports training. And this is obviously to restore tendon elasticity. And that is where the energy storage comes into place. If we increase the energy availability within that tissue, we're going to have a greater and more elastic tendon that is stronger and resilient. The loading strategy here, we got plyometric progression. We go from skipping, pogos, single leg hops, return to running plan, and we got some specific sports drills. Again, here we look at testing, and then we continue soft tissue therapies for prevention and maintenance. Our nutritional strategy is I've referred him off to a for personalised sports nutrition program with a nutritionist specifically for the prevention of re-injury and obviously improvements in performance. I've emphasized that he needs adequate calorie intake. He needs carbohydrates and nutrient-dense meals for energy balance. Continued high protein intake, obviously discussed the importance post-training protein and pre-sleep consumption to obviously optimize recovery. We tapered the collagen and vitamin C protocol due to improved tendon status. Obviously, he can continue with that if needed. And we've looked at bringing antioxidants and anti-inflammatories such as tart cherry juice or blueberry smoothies, omega-3 fatty acids, curcumin, as and when needed. I don't usually recommend taking these all the time because they can also have a significant effect on healing, especially during the rehabilitation process. So just bring that in moderation. If you've got patients that are coming in, they're doing well, and they're telling you that they're taking curcumin all the time, probably tell them to stop. They don't need to take it all the time. Maintain focus on micronutrients, and then obviously review and retest the vitamin status. Rehab isn't static. It's a progressive process. The key takeaways here is understand the condition you're treating. Nutritional needs change with training intensity, inflammation, and healing stages. A one-size-fits-all diet may miss key recovery windows or overload later phases. Thank you. Obviously, your time and attention is truly appreciated.
Right, thank you, Mark. I really enjoyed that presentation. Just before we do a bit of Q&A, I know we only have 5 minutes left. Just wanted to bring up the slide where you can find out more about us at the Center for Integrative Sports Nutrition. So you've got our website, you've got our socials at the bottom, our YouTube channel, and our Health Feeds Performance podcast. So if you like the work that we do, please feel free to follow us, interact with us, and we're also open to suggestions. So contact us if you have any suggestions for a topic you'd like us to explore in a webinar or discuss in a podcast. Okay, so we have already a few questions that came in. I'll just read them out if that's okay, Mark. So,
yeah.
Do you consider tendinopathy and tendinitis synonymous for the purpose of this presentation?
So there's definitely a terminology sort of debate going on, whether it's a tendinitis or a tendinopathy. With recent current research, a lot of it's just referring it to a tendinopathy because tendinitis has got the itis in, and so the tendinitis first came out years and years ago when they thought that it was just inflammation of the tendon. And with new research showing that it's actually the disorganization of cells and the breakdown of that extracellular matrix, overstimulation of those tenocytes, it's more of a collagen issue than a inflammation issue. Obviously, the inflammation is going to be a part of the healing process because that's the body's natural healing effect that it has. And so inflammation in this case is our friend. But when it comes to the description of tendinopathy, and I just explain to patients that it's a tendinopathy because we're not dealing with an inflammatory condition. Inflammation is part of it, but it's not the main cause of it. So yeah, I just like to use that terminology because it kind of gives a clear boundary.
Is it essential to combine all 7 principles to encourage recovery from tendinopathy? And what would be your approach or advice to patients who have certain dietary requirements, allergies, or intolerances?
That's important because you need to obviously understand the individual and understand their health history. So it is crucial that you go through a full medical record with them to understand if they've got any sort of dietary requirements, allergies, intolerances, if they've had any sort of specific medications that they're taking, and there might be certain interactions with certain supplements or nutrients with those medications. So just reviewing those aspects is crucial, and it should be part of your initial assessment. When it comes to the 7 principles, no, you don't need to combine all of them. Like I said, if you've just got a patient coming in and they, not an elite sports athlete, but you can modulate their load correctly. We know that they've got a vitamin D deficiency, maybe they've got a gut issue. We can kind of implement small steps for them, and it's small changes. We don't want to kind of overload them again. Too much load, too much issues. So we just bring in small steps at a time for these patients, and that's why walking a road with them and telling them it's going to be a process. You'll get a lot further with them.
And will increasing the recommended daily dose of collagen to perhaps supplementing twice a day instead of just once a day help with collagen repair and tendon healing?
Yes, so I would definitely say that there's no harm in the amount of collagen, but I would say it's more about the timing of when you take that collagen. So if you've got the individual coming in for maybe a session with you and then going for an exercise session later, then sure, I maybe bring in a little bit of 2 doses. But I'm generally not going to recommend it to patients. I usually just say this, get the timing of this supplementation regime, especially the collagen and the vitamin C prior to the consultation or prior to when they do the exercise on a daily basis. And then all the other supplements, vitamin D, magnesium, all the other ones that you recommend, those can be given at different times of the day. But specific to rehabilitation, collagen, vitamin C, 1 hour before, and that's going to have the greatest sort of effect.
Okay, I think we have time for one more. I've had a proximal hamstring tendinopathy on my right side for 3 years. Is it a chronic injury that I will definitely need to manage indefinitely? I'm a daily runner, training for 2 Oceans and Comrades again this year.
Okay, so obviously, have you had any sort of prior treatment for this sort of condition? Is it something that is just reoccurring? Is it affecting you currently? And is it a tendinopathy specifically? So we'll be asking those sort of questions. It's difficult to give you a direct answer. We'd need to obviously do a full sort of assessment and history and determine what's going on. When I see some of these proximal hamstring issues, if it gets better, then gets worse, then gets better, then gets worse, you're kind of moving from phase 1 to phase 2, phase 2 to phase 1, then back to a normal tendon. So there is a process of continuum. There's that continuum model that we've discussed. But one of the things that I will mention, and I haven't mentioned, is identify if you've potentially had a previous disc injury, maybe a nerve impingement. So a lot of the times when we come in with these sort of chronic recurrent tendon issues, especially if there's no degenerative changes on imaging, then I'll be looking at if there's a biomechanical shift or if there's a neurological involvement. So don't forget to assess for sort of radiculopathy or nerve root impingement.
Cool. And then last question, it's more about the recommending nutritional support post and during training and for certain conditions. However, we're always reluctant when it comes to the possibility of contamination of a product and the anti-doping risk. So what advice would you give in that case?
So it's obviously, so we're coming across a recommendation for nutritional support. So most of your athletes, you want to get a good reliant supplement company, making sure that they are doing the tests that they need to do. And this is why I always start with whole foods, looking at good food consumption and getting the right foods in is quite crucial. So if they're hesitant and reluctant to take supplements, then you need to kind of focus on getting that in their diet, supporting that nutritional intake through foods that they're consuming. So I think it's key that we don't move away from the whole foods philosophy, because supplementation can be quite critical for individuals that are just not eating a colorful plate of food all the time, or getting the nutrients that they need in because they're rushing between meals, or they're not eating enough. So supplementation will help with that, but I would then just recommend good whole foods for those individuals.
Yeah, I'll just add, obviously, if you're dealing with an athlete who's subject to testing, which could be anyone who competes for a club in the UK, especially a competitive level, then you want to consider batch tested supplements through a program like the Informed Sport program. So that's kind of what we advise in the UK. Yeah, is there anything else you'd like to share, Mark, before we end the webinar?
No, it's been great. Thank you again for giving me the opportunity to present today. It was nerve-wracking initially, but I eventually came out of my shell. So thank you for being patient and sticking with
Great.
it.
I think you did really well. And I really liked your analogy with the wife and the husband and the builder. I thought that was great.
Yeah, I always try, like, it confused me a lot when I was trying to study it. So I was just like, what could I think about in terms of relating, or what sort of scenario could I relate this to? And at the time when I was studying tendinopathy, we were doing renovations at the house, and my parents, there was a lot of pressure from my dad, and my mom was just stressed all the time, and it took about 1.5 years to get the building work done, when it could have been done a lot quicker if there was just no real pressure there. So yeah, where there's harmony, there's happiness. Happy wife, happy life. So
Great. Thank you, everyone. So yeah, just keep an eye on our socials for the next webinar, which will be on the 14th of May. So it's not the first Wednesday of the month, it's the second Wednesday of May. So thank you, everyone. Have a good evening.